Well, good afternoon, everybody. My name is Christian Malaster. I'm a member of the Matrix board here and also the founder and CEO of Ingenium Digital Health Advisors. My pleasure to be the moderator for the Leading Transformation track, something that Matrix started I think the last conference was the first time when we kicked this off, and Dan and I did a session, I think 2 years ago on design thinking, so we've been collaborating and focusing on innovation quite a bit, and I'm very excited to introduce to you here a longtime contributor to the Matrix Summits. Even though he now lives out west in California, he still travels back here and contributes to our great program here. Dan Weberg, he's a nurse and educator and innovator, and if you've read his profile, a trailblazer. He's been the first of many, many things, and so I'm very excited because Dan is one of those speakers who has actually been in the trenches providing patient care. Right? Oftentimes in telehealth, we talk about technology and research and all of these aspects, but I like clinicians, people actually who have worked with patients, to tell us what is the good guidance, what's the innovation that happens. So, and if you were to draw a Venn diagram of nursing, innovation, and human-centered design in that group, you would find Dan as probably one of the first participants there. He was the first graduate of a PhD program in healthcare innovation leadership that he completed after he did also his master's in healthcare innovation and bachelor's in nursing. And so, yeah, nurse innovators is obviously what you were destined to be. He's been the vice president of transformation services for Ascension, as well as the head of clinical innovation for Trusted Health, and then spent many executive roles at Kaiser Permanente in nursing innovation research as well as technology strategy. Now he is lending his expertise to anybody who wants to innovate and do strategy and innovation ecosystems. And today, in 1 hour, he's going to teach us on how we can do build a culture of innovation in our organizations. So please join me in welcoming Dan Weberg.
Thanks, Christian. Appreciate it. I think this is my 6th or 7th year with Matrix at different opportunities. So I'm going to hold this because I don't stand behind podiums well. So thanks for joining me. Today we're going to talk about something I'm very passionate about, which is healthcare innovation. Like Christian said, my PhD was on building leadership capacity to lead change in health systems. That's what I'm really passionate about. I've done my research on, written books about it. And so hopefully lend you some insights. And trying to take that work, and one of my roles at Trusted Health was the head of clinical innovation, which eventually morphed into a CNO role for a staffing agency in the middle of the pandemic, a nurse staffing agency. So bad word, nurse staffing agency, good opportunity to learn about lots of different things that are broken in our health system. So I'm going to talk a little bit about those type of things and then tie it back to the foundation of all of this, which is leading in complex systems, complexity science, and some of the insights that we can learn from that body of work as we lead out of the pandemic and all the other crises that are going on. So no conflict of interest, and our industry is changing. So let's talk a little bit about that. So we did this at Kaiser, I don't know, 2015 maybe. And I don't think it's changed that much. These were the 3 design principles we thought were going to drive healthcare into the future at that time. We created a story about that called Imagine Care Anywhere. But I think they're still true today. And we're still executing towards this. Everyday life is the new context of care, not the 1% of time people come into the building. Integrated care teams are linked to people, not places. And personalized health experiences are enabled with technology. Would you agree we're still sort of on that roadmap, 8 years later, right? We're still headed that way. We haven't achieved it, but we're seeing more and more disruption towards these goals, and we'll talk a little bit about that, and how disruption for a leader of change or innovator is actually the best time to lead that change. So we have these sort of signals, these patterns of behavior from a complex system standpoint that are emerging that show us there's a disconnect between what people want, both employees, providers, clinicians, and our patients, what they want and what the healthcare system's giving them. And what's nice is if you can look at these patterns, they give you places to focus your energy around change. So one, we still have policies that restrict access to information in our health systems. That means you can't open up an app and look something up. You have to log into Lippincott or name your clinical education vendor. 37 clicks in. After 14 different single sign-on logins, you finally find the evidence-based answer to the clinical question you have. But when you're at the nurse's station, we'll put that phone down. You can't have that there, then your water, put it under the thing, Jayco's coming. So if you restrict access to information, what do people do? They phone a friend or they make it up from what they learned in whatever school they had, however long ago that was. And so that's one pattern of behavior that we see. The next one is training methods are not matching our practice environment. So I recently got an Oculus 2 headset. It is the most fun thing on the planet. Beat Saber is my new favorite game. I burn like 300 calories doing that thing. But we can train people more effectively. So there is a study out of, one of my roles, I helped build the Kaiser Permanente School of Medicine. I was on the founding faculty of that. And one of my roles there was to build our cadaverless anatomy lab. And so I got to look at all the VR vendors, all the cool content out there. And we actually locked onto a study by Case Western that showed using VR and plastinated models in your anatomy lab versus cadavers allowed you to teach the same content with the same test outcomes 3 times faster. So we said, well, why are we going to pay for a cadaver lab? Super expensive, procurement, all the infrastructure. We can give them VR goggles and plastinated models. And we did that. But when we go to like our health systems, we still have annual education days with poster boards and construction paper taped to a wall. It doesn't make sense. We can train people significantly faster, better, and aligned to what they need with technology, but we're just not doing it. So people are demanding a different way of learning. They don't want to click through. I just did my FERPA training because I'm faculty at Ohio State. I just did it in between sessions. The worst click-through thing, it was reading it to me. I was like, can we go faster? Where's the 3x button on this thing? So we're wasting people time, and we're not really getting the outcomes we need with those trainings. So how do we update that? People are demanding a different way of learning. And then the last one is work is flexible, mobile, and tied to passion, not pension. And we're seeing more of our workforce not work for Kaiser for 30 years and get that pension. In fact, they're starting to remove those pensions out of the benefits programs. They're saying, where am I going to be safe? Where can I be treated well? And where can I do the things that I'm really interested in? And it doesn't matter what your brand is anymore. There's not a brand loyalty necessarily. So these are patterns that we're seeing in our workforce, in our patients, in our technology, and we got to do something about it. These are really great disruptions that are sources for us to innovate because the barrier to entry for innovation is lower. And then we got these logos, right? You all know this. We don't have to go through this. But they're coming in hot, right? They see the conflict. They see the crisis in healthcare, and they're like, opportunity, $40 billion market. I want a piece of it. We may fumble our way through it, but we're happy to do that because we have enough resources. We have the structures to disrupt ourselves. And these legacy systems take decades to change. We can do that in a matter of months. And the one that's really interesting for me is Amazon. You know, they've disrupted themselves like 3 or 4 times in healthcare now, but I think they have the ecosystem to really change the game. Whether they do it or not, I don't know. I don't know anyone at Amazon. You guys might. But they can potentially put you on a telehealth visit, diagnose you that same day, put you on a Whole Foods diabetic diet, get you your durable medical equipment, send you your pill pack, know what you're buying and incent you to buy things that are better for you, socks that are softer for your feet and shoes that are okay and whatever it is. They have the whole thing. They know your life and they already know about you. They could just say, you know what? You're on your Amazon Fresh account, no cookies today, right? Your glucometer saying some things that we don't, necessarily agree with, and so we're not even gonna show you the cookies on your buying list anymore. They have the potential to do that. Well, now, data, blah, 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 privacy, risk, all those type of things, but that's the ecosystem. Now you think of a legacy health system, all right, I need an appointment, I'm peeing a lot. Well, that'll be 6 months. All right, finally got my appointment, 5 minutes. All right, now you gotta go down to the pharmacy, you gotta go down to lab. 2 weeks later, they finally send you your interpretation. You get a diabetic educator on, okay, we're gonna set you up with your thing, go to CVS and buy your kit, and a year later, you're kind of set up, but you don't really know. And then they're like, here's a bunch of paper to read about your diagnosis. Can you just flip through it, look at the bold words and, buy better food. We're not there. We don't have the ecosystems. And so that's going to be pretty disruptive. The others are interesting. CVS obviously has the locations. the physical locations to provide care everywhere, same as Walmart. These two guys are going to be in data search and wearables. I don't think they're going to make an ecosystem, but potentially you could port your medical record everywhere, right? I mean, that's, I think, Epic's next play. They're going to go direct to consumer, say $20 a month, your whole health record on your phone, you take it to whoever you want to, and we'll seamlessly integrate that with somebody. I don't know anyone, I don't know Judy Faulkner. I've seen her. I sat on a bus with her last hymns. But it's very interesting to just overhear her conversations on the way to Star Wars land. She had an entourage. But that's sort of what we're dealing with, right? So these are the disruptors that we have to say, which could further the crisis of healthcare because they're coming in with a completely different angle and they're not afraid to fail. So disruptions here, the newspaper's on fire. So how do we embrace that? As leaders of change, as people in the know in healthcare, which I would argue those companies don't know healthcare and they're not hiring the right people. In fact, if you follow me on LinkedIn, I just made fun of one of their posts recently about their job description about clinical innovation that had no clinical requirements. It had MBA for 5 years in a big consulting firm, have run business lines. I'm like, I don't know if you're going to convince any clinician with that job title to do anything if they've never actually touched somebody. So anyway, disruptions here, but it's an opportunity for us to actually move our slow systems a little bit faster. So let's look at some of the evidence about why markets change. And there's a great book called Managing Innovation. It's on its 7th edition. It's by Tidd, T-I-D-D, and Besant. Those are the two authors. We use it in our Masters in Innovation program as one of the foundational texts. Has nothing to do with healthcare, has everything to do with the case studies around change in healthcare or change in industries. And there's really 3 reasons why industries change or markets innovate and disrupt themselves. And it's fractures in the fault line, unthinkable events, and running out of road. So let's go through each one of those. Fractures in the fault line. Now, I hear a lot of this. Let's go back to what it was like pre-COVID. I'm like, it wasn't that great. We just didn't have, it wasn't as fractured as fast, but we still had a lot of these issues pre-COVID, and they got wider as we went into COVID. So poor ability to forecast needs. Now, remember, I was a chief nurse for a staffing company. I got to see across 2,000 facilities, 6,000 nurses on assignment, all the way through the pandemic. No one could figure out how many people they needed at any given time. So what they do, they jacked up bill rates for those, right, the hourly rates for staff. That was the only lever they could pull because we knew the demand. I could ingest from the systems every single job available for a nurse across the country. No one knows where nurses are, or really any clinician. There's not good data in real time of the workforce. So we're like, hey, we're in North Carolina, we need ICU nurses. I wonder how many ICU nurses might be in the area that could travel to North Carolina. We have no idea. So let's pay them $250 an hour, and the people across the street from the hospital, North Carolina, are going to come across the street and work over here, and we're just trading back and forth. There's a finite pool of people. We didn't magically create more by paying more. We just traded across different systems. So that supply and demand equation is a huge fracture for us. And then they get hired into a contract, or they're onboarded as a new employee. And they're like, look, we need you so fast. We're dying here. We need so many patients. We're overloaded. But you have 2 weeks of lecture-based modules you have to complete in order for you to step foot. I don't care that you just came from Johns Hopkins in the tertiary, ICU. Doesn't matter. You're now here in our hospital, and our EPIC training is different. And so we have some issues that we can manage there. And then clinicians were treated like a commodity as well. So it's like, we need people. In New York, for example, at the beginning of the pandemic, they called for 10,000 nurses or something. Overnight, we were able to fly 200 nurses to New York. 30% were canceled the day they walked in the room. They said, we had too many. So these are nurses that at the beginning, the bill rates weren't $300 an hour. They were on a mission. They were there to do something special. They found a calling to go into the war, and they were canceled on the spot because the supply and demand issue. So, and that further continues as we just see, we used to call it 2 feet and a heartbeat. Just 2 feet. We just need someone to be there, somewhat alive, maybe pass their drug screen, and we're good. New grads still can't find jobs. Still 70% of new grads are finding jobs, 30% are not. When you're in a shortage, how does that happen? New graduates, I just saw it on the physician side, right? I think it was 20% of ER residency matches didn't happen this year. There's 20% of the ER matches went unfilled. That's crazy. So we have a shortage, and these new entrants into our professions are unable to find roles. And from an education standpoint, we're still graduating generalists for the most part. Both medical school and nursing school specifically are generalists, PT school as well. But our hospital systems are calling for specialists, virtual care nurses, ICU nurses, level 4 NICU nurses. But we're graduating people that can maybe step into a low acuity medical surgical unit. And so we have to just rethink how we're training. So again, these are all disruptions that are causing us to have the energy to create change. And then finally, the flexible workforce. Again, we talked about that. And so how do we embrace rethinking our teams as ours forever and think of it as a more fluid model? All right, so the second reason why industries innovate is because unthinkable events. So the actual product that they have is not meeting the needs of the people buying it because of some sort of massive change in the environment in which these organizations operate. So COVID, war, bank collapses, what else is going on today? Some sort of media thing, politics, whatever it is, there's all these factors, these things that you can't plan on that occur that completely shift the operating structures of organizations. As an innovator, it's a great time to create change. So if you can rise above the chaos and see the idea that you can now challenge people's assumptions because there's no going backwards. In COVID, it was like, we can't go back. There is no back. We only have to move forward. We can only deal with what we can deal with now. It forces people who are resistant to change to start to change. So if you look at diffusion of innovation theory, there's the laggards, the last group to adopt change or not adopt change at all. They start to be forced forward because there is no other option. Resistance is futile. And it shifts priorities. And so how many of you were in units or on clinics or in organizations that were like, before it took 14 VPs to sign off on something, and then all of a sudden it was just like, just fix it, just do it. Whatever you need, hire, move that thing, delete that button, you could just do it. But then now that we're moving back to stability, they're like, well, we need those 14 VPs again. If you didn't need them in the worst moment of your life, why do you need them now? So how do you look at the structures? Like in chaos, new structures emerge, right? So you can think of heating, the analogy is you can think of heating oil in a pan. You pour the oil in cold, it's one glob. You heat it and little bubbles, little modules pop off of that. So when you add energy to a system, new structures emerge. We created new structures because we had the energy from a crisis to do that. Which ones are more relevant now than they were before? So which ones are you going to keep? How do you remove those decision-making patterns? Because you are forced to be more efficient. You're also forced to do things that probably don't need to stay around. But critically assessing those organizational changes in reflection is a way for you to lead and actually use crisis as a way to catalyze new structures in your organization. And then the last thing, and this is a nursing example, we could insert pretty much any profession in here, but since I'm a nurse, I'll just use the one I know. The last reason that industries innovate is because they run out of road. The product runs out of road. It's no longer relevant or is unable to meet the needs of the people who buy it. And if you think of our professions, we're running out of road. So through 2029, and this number is probably low, 175,000 nurses are needed every single year through 2029. We only graduate about 125,000 nurses a year in this country. So we're already at a 50,000 per year deficit for the next 10 years or 6 years. It takes a year for them to be productive and be able to take patient loads by themselves, really in any setting. And so it's like buying an iPhone and saying, well, you can't turn it on for a year. If that keeps happening, you're not going to buy the iPhone anymore. And now health systems are trying to figure out what other people can do the work of our clinicians because we can't get enough of the ones that we thought we needed. And so it's forcing some adaptation. Now, some of that's good. We should remove some of the non-value added tasks from some of the professions, but at the same time, what are we going to do with that? And then the last one, other professions are increasing their scope of practice, and nursing for the most part has stayed flat. And so that's a specific example to our profession, but I think there's just an opportunity for us to rethink the roles of the team-based care and who does what. And there's some interesting dialogue about that if you're on Becker's. So with all this negative stuff, I've been negative Nelly for the last few minutes, the good news is that innovation requires constraints. And so one of the myths of innovation is that you need blue sky thinking and lots of Post-it notes. And that is the opposite of innovation. That is a nice brainstorming activity. I call it a Post-it note party or a pizza party because usually it's at an offsite and you have all those Post-it notes and you're like lumpers and clumpers, and then you take a picture of it, and then it goes into some, leader's drawer, a virtual drawer, never to be seen again. But we had a lot of fun, and we solved high blood pressure for our community with apps. Like everyone has an app when we do these brainstorming. No one's ever gonna create an app. Stop creating apps. If any idea comes out of your brainstorming, it's an app, delete it. What you need is to, as an innovation leader, even in crisis, is to create a bucket and to create the box. We always want out-of-the-box thinking. In order to harness the energy of creativity, you have to create constraints so the solution that comes out has some relevancy. Because if you're just like, well, imagine the possibilities, that's great. That's one tool of innovation. It is not the entire reason innovation exists. Then you have solutions like apps and things that are just not going to happen in your organization. So as a leader, what are those constraints? They can be financial constraints. They could be time constraints. They could be resource constraints. They could be you're not going to make an app constraint sort of thing. That focuses people. It allows them to clearly know what's not possible so that they can innovate and create a solution that's more relevant. So in order to innovate, we also need to change our narrative. So yesterday we had a pre-session with Chick Thompson, who's a creativity expert. Many of you, I see familiar faces, are there. And he comes from outside healthcare with ideas about how do you take NASCAR pit crews and apply it to some sort of solution, right? Really thinking differently. But some of the answers that in conversation we had was, well, there's a lot of regulation and we don't have enough and we're all burned out. And so if that's our narrative, it's going to be very hard to change anything because we've already convinced ourselves that we're at a place where we're just surviving. And if you look on professionals' Instagrams and TikToks lately, the narrative is really negative. It's us versus them, management versus the direct care, or this profession versus that profession. And there's a lot of divide there. And I think in order for us to innovate, we have to change the narrative into the possibilities and where can we head and how do we build our desired future instead of doubling down on what we used to know. So this is our blockbuster moment. This blockbuster, okay? Top Gun Maverick. Great movie, very nostalgic, had a little bit of innovation in it, but still honored the past, but moved us forward in the storyline a little bit. Whether you like Tom Cruise or not, I don't know. Just the opening scene, I was like, oh yeah, we're good. And I know there's military folks here who probably live that every day. You're like, that was so dumb. But for me, it was very cool. We want that blockbuster, not this blockbuster, okay? So this is these are from my friend who lived in Bend, Oregon. This is the last blockbuster. Have any of you seen the documentary, Last Blockbuster? Oh, you gotta watch it. You gotta watch it just because it's made by Netflix. Like Netflix beat Blockbuster and they made a documentary about it. That's like PT. Are there any physical therapists here? Okay, I'm gonna use them as an example. It's like PT, like they beat out nursing. Like nursing no longer relevant because PT took over, and then they made a documentary about how they killed Florence Nightingale or something. It's just, it's hilarious. But so it's a great show, and if you want to know how the leadership characteristics to cling on to everything in the past, that documentary will show it. They literally would steal computer parts from the DirecTV store to fix their 1990s computer so they could run the checkout system that doesn't work on modern day computing. That's how tied to nostalgia they were. And then they would talk about the smell. Oh, the smell of Blockbuster was amazing. I don't remember the smell of Blockbuster being all that great, or the searching for movies that were disorganized and not able, you couldn't find the one or it was checked out, and then the late fees. So we don't want to do that. So let's use Blockbuster as an example of high growth and how they got very comfortable in where they were. So at one point, there were 9,000 stores, Blockbuster stores in the United States. And in just a few months, they went down to one left in Bend, Oregon. They were opening one store every 17 hours. One store every 17 hours. So talk about high growth, rapid impact. The day they stopped, because eventually after Netflix came out with their no late fees, when Blockbuster decided to stop late fees, overnight they lost $250 million in revenue. So if your number one worst customer experience moment is your highest grossing revenue generation form, probably not a good business. So, look at healthcare. Like, what do everyone hate? Like surgery, and that grosses a lot of revenue. And so we have to think about that. But they lost $250 million overnight. So because they weren't ahead of the curve, because they weren't looking at the patterns of behavior and consumer buying habits, they were very slow to change. And ultimately, the fatal flaw, that is the last Blockbuster right there. If you walk inside, you see all those pictures I showed you. The fatal flaw was Blockbuster doubled down on the past, and they adapted too late. Eventually, they had a website that had streaming and mail order and all the things that Netflix had, and ultimately they lost because they were undercapitalized to change. But they also lost because Netflix invested and built the future they wanted. At one point, there was a choice in the industry. You could go to VHS Plus, or you could go to Blu-ray. And Netflix doubled down and invested in the technology to make Blu-ray the standard. So in doing that, they already knew the future, and they were able to build the business around it. Meanwhile, Blockbuster was like, oh, DVDs, can't have that. We have VHS. And so they just were adapting too late, and Netflix was building their desired future. And I think it just gives us a good analogy to think about. We're reacting to all these things. We're reacting to staffing shortages and policy and all these different things. How do we build the future that we want? How do we fundamentally shift and invest in the systems that we need to change instead of waiting for someone to do it for us? And I think when I was at Kaiser, we had a philosophy at the organization. We wanted to build everything. We were the build it. We never bought it. Oh, vendor, you're great, awesome. We'll just do that ourselves. We have the resources. We have the IT teams. And at one day, they realized they couldn't keep up. And so they switched to the buy mentality, and it happened in a moment. There was a big executive meeting with IT folks, and they had some vendors there, and I think it was Samsung. They came through, and they were like, this is the latest laptop. It's gonna change all your clinicians' charting. Look at how easy, it's touchscreen, all this stuff. And one of the executives just took it and threw it on the floor and said, we are not gonna buy this. We're gonna tell you what we need, and you're gonna build it. And that's a shift. That's a shift in the power dynamic, that this $85 billion company was sort of letting vendors tell them what they needed or trying to hack it together themselves, and instead said, we're the experts in knowing what we need, and you're the experts in building cool stuff. Let's figure out this partnership. And again, another way to lead out of the system. Now, if you look at Blockbuster, they were like, no one's ever gonna stream TV, and brick and mortar is the way to go. A lot of those similarities are happening in healthcare. Don't be Blockbuster. We can learn from the past, and we can start building our future. So, the rental industry. Why did all this happen, and how did this Blockbuster go down quickly? Gives us insight, and I'll relate it to healthcare as well. There are fractures in the fault line where streaming was becoming a possibility. Blu-ray and late fees, those were fractures that were getting wider between what was being offered and what was emerging as the new offerings. There's the unthinkable event, which was the financial crisis of 2007, which undercapitalized the existing companies. And Blockbuster got bought out by Universal, and then Universal invested in other stuff and didn't give capital to Blockbuster to actually adapt and meet the current needs. And they ran out of road, they ran out of money, and they had too many overhead expenses because of their locations that they could no longer function as a legitimate business, and they ended up going out of business. But these other companies were set up to jump in right on that, right? So with the crisis of the financial crisis, which opened up opportunity from a capitalization standpoint, as well as the shifts in technology, there were companies that were ready to jump in and take advantage of that. And we use all of these, and no one uses Blockbuster. So why do innovators thrive in chaos? Well, they challenge assumptions. So the innovators on that last slide, they stopped the worst part of the business, the worst customer experience side, which is late fees. They started moving towards where people are. So videos everywhere, just like Care Anywhere. It could be videos anywhere, streaming, and they created content. They were building the content that they saw. They could look at who was renting what type of movies, and then they could invest in making movies themselves. They were building the future based on data. They led differently. They led with technology, they led with building their desired future, and they had resources in investing in the things for the future, not just trying to recover and go backwards to where they were. And then they powered it with the right people. So time, they had choice. Netflix overpaid or paid more premium for top talent, and they allowed for flexibility. You know, they're based in Los Gatos, right near Santa Cruz, California, but you could live anywhere and work at Netflix. And so they changed fundamentally the norms that were in that industry, and they were able to then catalyze their future. So what about healthcare's blockbuster moment? Well, here's where our paradigm shift is happening. We're in the middle of moving from the volume approach to the value approach. And fundamentally, that takes a different type of organization to accomplish. So we are moving from episodic visits to continuous relationships, care system ownership and control of the care system, to the patient having more autonomy, safety as being the responsibility of the clinician, moving it to the responsibility of the system, and anticipating needs and reducing waste. It takes a completely different, this is a very transactional leadership model that requires you to do this. This is a very transformational leadership. Those are very different competencies. If you read the Handbook of Leadership by Bernard Bass, he can tell you all the evidence. And I wrote a paper one time about the difference between transactional and transformational leadership and its impact on staff retention. Guess which one won? Transformational. People want to be thinking, they want to do their work, and you don't have to be innovating all the time, but they want to be focused on some sort of vision that's going to meet the needs where they know things should be headed. In every other part of their life, they have innovation. Then you walk into your office, your clinic, your hospital, your virtual care setting, they're like, God, this is 30 years old. And so how do we transform that? So there's three ways that, or there's a couple ways that we can thrive in chaos. And so we're going to dive in a little bit to those leadership tactics now. The first one is challenging assumptions. Seems very easy, but the role of a leader in change is to be a deviation amplifier. And so you have normal operating procedures, or normal ways that you interact with people, talk to people, meeting people, the meetings, the hierarchy. You have lots of norms that have been there for a long time. And then you have people that want to disrupt that. So in order to lead change, you have to find the things that are not value added anymore and fundamentally change them. That could be how people talk to each other. That could be the way you run a huddle. That could be the way you run a staff meeting. Those norms are set, and they keep people in the same sort of operating pattern over and over and over. So if you're going to lead transformation, you have to find those norms and fundamentally disrupt them. Find the deviation and hardwire that deviation. And good deviation, not like, not good deviation. Like we're going to do this surgery without anesthesia today. It's new, it's amazing. Like maybe not, like that deviation's bad. But changing the way you run a staff meeting, including people, simply changing the way the room is set up from a classroom style to a round, look at each other, team-based style, can fundamentally change the energy in that room and how people interact. So it's little things like that that can shift. We have to lead differently. We talked about that, move away from the transactional leadership to the transformational behaviors. And then we have to power our clinicians to be able to elevate the needs and the changes and be a part of that instead of doing it to them. So let's look at that. So how do you challenge your assumptions? Well, one, you have to be open to new ideas. Now there's some research out there by one of my mentors, Dr. Bern Melnick, who is an evidence-based practice guru. And she did a study on why evidence-based practice adoption fails in health systems. And who do you think the number one barrier to change in health systems was? I'm using health systems broadly, inpatient, ambulatory, etc. What role was the number one barrier to change in a health system? What was that? CNO. Leadership. The nurses? It was the nurse manager, right? That critical link of all things happening on a unit or in a clinic. They were the number one reason. And the reason was because they're stuck between staff needs and executive needs, and they're not incented to change, right? Their goal is to maintain the status quo at all costs. Get staff there, call those people, make that thing happen, get that patient out, get that physician over here and get the discharge orders, all those type of things. They're not incented to say, hey, how do we like blow up this thing and lead differently? No, that is not part of their job description or their bonus structure. So we have to start just knowing that, and it's not their fault. It's not like they're just sitting there like, I hate ideas, I hate innovation. It's not what they're doing. They're just not, it's not part of their day. And so how do we know that and help open up that idea, that mindset of welcoming new ideas? We talked about innovation being Post-it notes. I guarantee this is what many people in your organizations think innovation is a Post-it note party. And there's science behind innovation, just let you know. There's a whole body of evidence, and Post-it notes are not on any of those bodies of evidence. That is one tool. Design thinking is one tool. I love design thinking, but it is not innovation as a generality. So we have to go on. Innovation is those tough conversations. That's what changes norms, addressing issues. When you have toxic employees that are causing rifts and drama and all this energy suck in your organization, that's stopping people from being accepting of change. So you have to have those tough conversations in order to lead innovation. The next one is, your idea is not the best idea. Regardless of what people tell you and how many times you posted it on social media and you got likes, it's probably not the best idea because you're one person. So how do you partner? How do you bring in and build that diverse team? We'll talk about what those diverse teams could look like. And then you have to demonstrate innovation. And the number one thing that we can do better in healthcare is risk. How do we take calculated risks and allow people to fail in some of these changes that builds that norm, that new norm, that it's okay to try something if we've thought about it and we have that calculated risk-taking ability. So demonstrate those innovation behaviors. And then we have to lead differently. So like I said, I like researching what the leadership behaviors of innovation or novel change in systems is. And it comes really down to these 4 things. And we could talk about the 8 behaviors, and we could look at the dissertation, and it'll give me nightmares. But if you distill leadership down to these things, number 1, you have to build connections. It's all about information flow. So in order to get the information to make new, more relevant decisions, you have to have these 4 things. 1, you have to build connections. That means you're connected to people both inside and outside your organization. Connection means you can reach out to them on social media or on the phone or in an email to just try and share or connect or network around ideas. Conferences, great place to build connections. Then you have to cultivate some relationships. Now you'll have a lot of connections, fewer relationships. And a relationship is you trust that person, mutual trust, and you share trusted information in your exchanges. So I can email Christian, I can trust that what he sends me is probably pretty good, right? I don't have to sort of fact check it. If I email rando person on LinkedIn, probably going to send it through ChatGPT first so I can know if it's right or not. So you want to build these relationships that you get very trusted, more concrete, more specific information from your relationships. Then you have to live on the edge of chaos. And living on the edge of chaos, in the complexity world, there's 2 extremes. There's stagnation, which the only things that are stagnant are rocks and dead things. And then there's extreme chaos, which means everything is unpredictable and there's a lot of energy in the system. What you want to live on is right on the edge of that chaotic, that chaos. And right on the edge is where the most energy is coming through the system in a way that's interpretable. That's what the edge of chaos is. So that's where you can spin up people. That's where you change some of those behaviors and people get kind of frustrated. So one example, I was leading a curriculum meeting for a nursing school. They wanted to embed innovation into their curriculum. So I led the day. And we had the room set up in rounds. It was usually in classroom style like this, but we had set it up so they had to talk to each other, which, faculty, they don't always like that. And I wasn't introduced yet, and the faculty walk in the room. And they're like, this room is not supposed to be like this. I have to turn my head to see the screen. And I usually sit over here, and now my seat's here. Who did this? And they look at me, and they're like, are you from facilities? Did you do this? And I was like, no, I didn't do it, but we'll just go with the flow here. They introduced me, and their blood went out of their face, like, oh God, like what did we just say to that guy? But they were so disrupted, they couldn't function. They were so frustrated. You could hear the little talk. Oh, what are they doing here? I think I'm just going to go to lunch instead of coming here. But they were so disrupted. You could feel the energy in the room where they were not focused. And so as an innovation, what I did is I took that energy and said, you feel really uncomfortable right now. I can feel your stress that we are different. And we catalyzed that into a whole day of pushing them even further into that. And by the end of the day, they had created some new curricular models for embedding innovation to undergraduate curriculum. But it's harnessing that disruption. So how can you as a leader create that disruption intentionally and then harness it moving forward? And a lot of times we wait for that disruption. Either we avoid the conflict until it blows up in our face, or we have that staff meeting every month and that person stands up and says, we're going to do that. And so how do you actually force and control those events to create that energy and then harness it to move forward? When you get people sort of frustrated, awesome, I can feel you're really frustrated. Let's dig into that a little bit. You can facilitate through that conflict instead of waiting for it to pop. That's living on the edge of chaos. And then the last one, which is my favorite, you need to fundamentally disrupt stagnation. Fundamentally dismantle stagnation. That means every meeting that you go to that you're multitasking on, stop going. Just stop. Delete that meeting and see if anyone notices. Right? There's so many norms that we just do because we've done it, and it creates time sucks, it creates energy sucks, and it doesn't add value to our day. So if you're going to lead change, you can create space for that, and you can create some disruption by dismantling those norms that are not adding value to you or the organization, questioning those things, changing the committee because the committee comes on and all they do is approve minutes and read the agenda and then the meeting's over. Probably not worth an hour meeting. So how do you fundamentally find those points that are stagnant, that have just been done because they're done, and start deleting those intentionally? We used to have a physician at Kaiser, and he would just not go to meetings sometimes. He's like, sometimes these meetings I don't find valuable, I'm just not going to go. And if it's really important, they'll probably call me and tell me I should go, and I'm going to wait for that. That's how he managed it. I thought that was a pretty bold thing. At the startup, every quarter, we would delete all meetings off the calendar, all of them, just blanket. And then we'd come back and say, what do we actually need again? Maybe it needs to be 15 minutes, not an hour. Maybe this person doesn't need to be there. These roles have changed. Maybe we need a different agenda or conversation. So you could do some of those things, especially if you're in a leadership role. Just delete your calendar. See what happens. Yeah, see who misses you, right? Maybe you can go play Xbox for an hour or something. I don't know. Try it out. I mean, those are the type of things that they're bold moves, but they'll disrupt you. It's sort of like yesterday with Chick. He was like, put the watch on the other hand. Put the watch on the other hand. Put the meeting on the other calendar. Put it on your friend's calendar and see if they go and they even notice it. Forward it, forward it to your brother or something. I don't know. See, those are type of things that you can do to sort of dismantle the stagnation in the day. Or, simpler things would be, how do you change the agenda to be a little bit more focused? How do you actually address the conflict instead of skirting around and say, we'll take that offline? Those are the type of things you can do in the moment. Or when those disruptive people stand up in your room, how do you channel that instead of allowing that to happen where everyone's all excited and then they're like, I'm not going to do this, and everyone goes quiet for the rest of the hour? How do you address that in the moment? That's the dismantling of those norms that are causing you to stay stagnant. And then there's 4 sort of personas that, 4 different mindsets that you can take to also lead innovation. So I use this with people who are new to innovation or new to committees and they're not really sure how to show up, but they're really good sort of ways to just channel your innovation energy in the meetings and the different interactions that you have throughout your system. So the first one is positive deviance. And anyone read about positive deviance? You know about that? So positive deviance, there's a great book called Switch by Dan and Chip Heath, all about positive deviance. Those are people that thrive in systems that are failing. So if you're in healthcare, you are a positive deviant by default, or now in banking. So if you're thriving in the systems that are failing, you are a positive deviant. Where we can look for positive deviants in our organizations are people who have figured it out despite everyone else running around crazy, head cut off, sort of stressed out, burned out, not functioning. There's some people that have all their patients tucked in, have got their orders in, have their feet up on the desk, and are like, this is cool, I like my job still, this is great. They've figured out some way to do quality work in the same conditions as everyone else, but they've been more efficient or they found a better way. And sometimes, I had experiences when I was in bedside at the ER. I'd have that, and they're like, Dan, why aren't you working? I'm like, well, everybody's done. I got it all done. Well, what about your team? You help? I asked them. They said they didn't want help. Well, we're going to have to make sure that this is going to be part of your evaluation. I'm like, okay. Like, it was a negative thing to be done with stuff. Like, unless I was running around, pushing buttons and starting IVs, I wasn't working. And so how do we look for people that have figured it out? This could be in the technology space. There's vendors that do this. There's certain vendors that have offerings that are just better, and they're not all chaotic. There's people, there's systems, there's teams. So look for those bright spots, those positive deviants. There's a source of innovation that you can replicate across your organization. And this happens a lot in crisis. The people that figured out how to deal with COVID patients first, how to do the proning, how to do the link, duct tape 17 IV lines out the door so they could reduce the number of people that went in the room. That's positive deviance. They figured something out. Legitimize those practices, and you have a source of innovation. The next one is systems thinking. So these are the people that can figure out the ripple effects of any choice. They know that when you change the registrations thing in the ER or the documentation in the clinic or the appointment structure, how many people that impacts within the organization. It's not just some linear thing. They know those ripple effects. So those are really great to test your ideas on. Hey, I want to try this new care model. I want to do this new visit type. I want to try this new technology. Oh, you got to think about blah, blah, blah. And in my experience, this thing happened. It just gives you insights to that system level change. And there's some people that just are really good at that. And so bring them onto your innovation team or have that mindset when you're going into an innovation idea. What are the system impacts that we need to anticipate? The next thing is network engineering. So on the inpatient side, I don't know what the ambulatory or virtual care side example might be, but on the inpatient side it'd be, these are the ER nurses that like the ICU nurses. Right? They talk to each other for some reason. They found some common bond and they've gotten over that rivalry. But the network engineer is the person that knows everybody. They're the one whose friend's friend is the brother of the CEO. They have access to weird things. Like Chick Thompson yesterday, he grew up next to the guy who made the Mousetrap game. And then he was like Forrest Gump in real life. It was crazy how many people he's interacted with. But those people have insights and connections to information that you don't have unless you are a networker. And so finding your network people, the ones that know and talk and go to the break room and the holiday parties and have those conversations, allow you to have different information, different insights, different viewpoints to catalyze new ways of work. And then the final one, and the innovators hate this, operations mindset is still a good thing. The operations mindset creates those constraints that harness innovation, that focus innovation energy towards what needs to happen. And so if you just have these first three, you have a lot of blue sky thinking, a lot of possibilities. If you bring in the operations, it focuses that in towards solutions that could be amazing. So don't be afraid to include your operators in your innovation work. And ultimately, you're trying to create a culture change. And so a culture of adaptability, one that's not reliant on the hierarchy to tell them to change, one that can anticipate a change in the moment and do that in a way that's sustainable over time. So I like Edgar Schein's work on culture. I think it's very simple to sort of understand. There's about 50 billion theories of culture. I called it context in my dissertation, so I didn't have to read all of those papers. Pro tip if you're in your doctoral program. But basically what Shine says is there's artifacts, values, and deep assumptions. Artifacts are physical representations of your culture, so that's the way people talk to each other, the posters in your break room, those sort of operating norms, how meetings are structured, that kind of stuff, your title. The values are what people value in your organization. Usually they can tell you, like, I value new graduates, or I value patient care, I like the best experience for our people. And then there's deep assumptions, which are those unconscious bias that drive decision making that, according to Shine, you could only have a consultant uncover. So he had a very good business model of creating a theory that was relying on consultants to figure out the hardest part. But those deep assumptions are very hard to uncover, especially if you live them, because you have them. And so it's that blind spot. But these two you can fix. So like that example of just shifting the room, or how you change your calendar, or how you interact with your team, you can change the artifacts, the way people interpret information and maintain those normal operating procedures. You can change that overnight. And a lot of times you don't need permission to do that. And so if you're leading change the artifacts, change what's in the break room, change how a meeting's structured, change how you talk to people. That can shift the other two over time. And so let's look at some of the evidence from a complex system standpoint. We got a couple minutes, 9 minutes. Okay, we can do this. Just high level. Complex systems is awesome because it talks about organizations of living things. And so for living things to live, they need these 6 things: autonomy, reproduction, repair, survival, adaptation, and evolution. You can take those analogies and plug them into an organization. So if you remove autonomy from your people, they're not able to make decisions or change without permission. They'll stop changing without permission. And that puts a lot of stress on the leaders usually to have to be that expert, and they're not the expert. And so you have to allow for autonomy. Reproduction, do you have a succession plan? Do you have mentorship programs? Do you have pipeline programs for the next generation or the next group of people that can take on these roles? If not, then you have people leave and you have big vacuums going on. And so the organization spends more time trying to fill the vacuum than actually moving the work forward. If they can't repair, if it's 7 shifts in a row and you can't ever get a time off and nothing's ever approved and all that kind of stuff, then people aren't able to repair. Again, they're going to focus their energy on themselves instead of on the work. The survival instinct, there's 2 extremes to that. You have self-preservation or group preservation. In crisis, people move to self-preservation. So how do you make sure they feel safe so that they can move to the group? And if you can have them focus on the team, then you can move an organization forward. Adaptation and evolution are sort of the same or similar, but are adaptation activities encouraged or not? So when someone comes up with an idea, like, we can't do that right now, we're too busy, we don't have enough staff. If you say that every single time, they're gonna stop adapting. And so how do you allow for some of those adaptations? Instead say, well, tell me about that. How could you do that and lead that yourself in the time you have? How can I support you in those things? And allow some of those risk-taking behaviors to happen. And ultimately, they'll be able to evolve. So do you support the new structures that emerge when all that happens? And then you'll get a high-performing culture, which has 2 things. One, performance improvement, improving the known. We do that through fish diagrams and A3s and PI. I'm not a PI guy, but I would do it through PI. And then you have the innovation side. And so high-performing teams have both. You can improve what you know, optimize what you're doing, and jump off into the new, optimize that, jump off into the new, optimize that. So a high-performing culture has both innovation and performance improvement. It doesn't just have performance improvement, or it doesn't just have innovation. Innovation, too much chaos. You just have performance improvement. You improve what you know until it's no longer relevant, like hand washing. We have performance improved hand washing to 66.67%. We've A3'd it. Name your tool. We've hit people with sticks when they don't wash their hands. We put lights on that glow on them and tell them, like, spotlight them. We have people stand there. We have the patients yell at them. It's still 66%. We need to figure out innovation, like no hands. You don't use your hands anymore. We have robots come in that get sprayed down with Lysol or whatever it is. So you need both. And then I'll just end on this one, which, diffusion of innovation. You've all seen this, I'm sure. Rogers theory of diffusion of innovation is the theory of adoption of innovation. It's not an innovation theory. Like 5,000 studies have been done using this as a framework, and this continues to be sort of the way adoption happens. You have 84% of people who will adopt a change, and 16% in a population who will never adopt it. But we spend 90% of our time on the 16%. If you're going to lead through crisis, stop trying to convince people. Find the people that are going to do it, because ultimately you're going to get it. I mean, Malcolm Gladwell, he says there's like tipping point. It's this. The tipping point, once you get past that early majority, the thing does itself. And so as a leader, how you find and spend your energy on that instead of trying to convince the laggards. And if you want a definition of laggards, there's on Wikipedia. If you just type diffusion of innovation and look in the laggard thing, perfect description. And you know these people. And it's not a label like a negative thing. It's fine. Maybe this change isn't for you. It's fine. I don't want to like label laggards and be like, you should be gone. Because we're all laggards at some point, right? We all adopt things at different points. But as leaders, we can't focus on that because we waste too much energy on it. And so we can actually catalyze self-sustaining change by focusing on the people that will adopt it. And I think that's it. I'll just end on this piece because the number one rule of leading innovation, again, a myth, is, oh, you have to be creative. Oh, I have to know technology. Oh, I have to, have the future. I'm a futurist. The number one rule to innovation is you don't have to be an innovator to lead innovation. And so if you can create the conditions in which creative people feel safe and can support their ideas and can be positive deviants and networkers and systems thinkers and operators, then you're creating a culture that's adaptable. You don't have to do it yourself. You don't have to be the person with the idea. So I would say you can go out and lead innovation with simple changes, and in crisis, the barrier to entry for innovation is better. So with that, I'll wrap up. We may have a time for a question or two, maybe, if you would like.
There's no questions online, so if anyone would like to pose a question to Dan, now would be the time. Otherwise, you can stick around as well.
We got 3 minutes. Yeah, go ahead.
You said you work for a nursing staffing agency. And
Yeah. Oh God. Yes, I did.
Sorry, my name's Erin Topelian. I'm a psychiatric mental health nurse practitioner. I work at Norfolk City Jail. So I was a nurse during COVID, and I agree there's a nursing shortage. And I do agree that there needs to be something solved for how do we get nurses from graduation into, the workforce and specialty. But what's your take on, from a staffing agency where you can only hire nurses with sometimes it's 1 to 2 years experience in that specialty? Do you have an idea of how do we train nurses in nursing school, or is there a preceptor program right out of nursing school that we can mentor them for a period of time? And would you hire those nurses in a staffing agency with less than 2 years experience in a specialty to try to innovate to fill the need in that area?
So I would say a couple things. One, we do need new workforce strategies, and I do think nursing education needs to create specialties, and not like you're going to be a level 4 NICU nurse right out of school, but critical care, ambulatory care, virtual care, acute care, even that would be helpful just to provide a better focused context. So I think that needs to happen. I think the second thing is that at Trusted, we said no one under 2 years could work as a travel nurse because of the chaotic environment in which you work. You need to have some background and some experience that will allow you to be better. Now, I hate the years of experience as a measure of competency because I don't think it's true, but we had to set some bar, and in COVID, that's the bar we set. There have been models at New York Presbyterian and a couple other places where they've partnered with travel companies to actually use it as a new grad pipeline, where the new grads were hired in as travelers for the first year. And at the end of the year, they could convert them to full-time employees or not. And if not, those travelers then had a year of experience to go off and be travelers. And so it's sort of a win-win. Little premium on the price to that, which was the benefit to the nurse. The organization didn't have to commit to someone that may not be a cultural or fit to the organization. And so there's been models like that. So I think that's an interesting way to use travel. But then at the same time, travel is one of those things that we adapted that wasn't ever set up to be a long-term solution. It was meant for snowbirds in Arizona. That's where it started. And so It wasn't meant to solve a crisis. And so we have to think of new workforce models like local pools and other things that allow for more flexible work, but aren't the kind of structured 13-week inflexible assignment stuff that we have with travel, I think. Hopefully that helps. Yeah.
Along those lines, you're saying telehealth should be a specialty. Can you be a telehealth nurse without having any hands-on bedside or clinic experience?
That's a good question. I mean, I'm definitely not a telehealth expert. I do think there's an opportunity to think of it. I mean, I started in the ER as a new grad. I had never touched a patient. I went to one of the most acute, I was at UCLA Level 1 Trauma Center as a new grad, and I was preceptored through that, and I ended up by that first year was certified as an ER nurse. So I think if we have programs that mentor people and give them the experience, it's a different way of interacting. My thought is, though, in nursing school, why do we just do hands-on training? Like, why do you do cardiac assessment on a mannequin and a patient and then you're done? Why don't we do that same assessment by video and then teach it by email and then by text and then by TikTok, right? And if we taught that in our fundamental programs, then they have the skill set to translate all the way through every modality we have. So I think we have to sort of start those type of things, and if we do that, then I definitely think we could have new professionals in the system. So, yeah, we'll do one more.
So we are coming out of one of the probably biggest crises that we will remember, right? And yet I have the feeling that we are rolling back on a lot of stuff. And really rolling back. I mean, from Medicaid, from telehealth ease, everything is rolling back. What is for you the one single factor, if any, one single lesson learned, if any, that will help heal the healthcare system in this country?
Oh man, I was not prepared for that question, so
Sorry.
Here's my answer. I would say we have to break out of the industrial revolution mindset that we have of healthcare, and unless we do, we will not heal healthcare. And that is looking at team-based care, getting over our egos on all the professions, trying to own some sliver and working as a team moving forward, and looking at technology as a superpower instead of an hindrance. If we do those three things, I think we move forward. If we go back to having to do more, I mean, I was in an organization, and one of the last days there, they're like, we're losing a lot of revenue. We need to do more cancer screenings so that we can do more surgeries so that we can have more revenue. That is an industrial mindset that needs to go away. And if that's the mindset we have in organizations, we're gone. Amazon Care is going to win, and we're going to all work for Costco, like in the movie Idiocracy. And so I think it's that. We have to break that mold of number of things equals value in healthcare, and we have to move towards outcomes in those things. So I think fundamentally it's that mindset shift. Yeah. So I appreciate it. Thank you. Christian, do you have any?
Great. Thank you very much, Dan, and thanks for sticking around here.